Hello everyone, welcome back to another video. In this video, we will be covering the Nagaland current affairs for the month of June 2026. As always, this is the first part of a monthly current affairs series where we will discuss only the important current affairs related to Nagaland. From last month onwards, I have changed the format of these videos because recording everything in a single video makes it too long. Due to lengthy duration, I often have to shorten the explanations. To avoid that, the current affairs have now been divided into three parts. The first part will be Nagaland current affairs. The second part will be news beyond Nagaland. And then the part three will consist of the MCQ combination of the Morong Express and some additional MCQ questions. So this format allows me to explain each topic in a better and more detailed manner without making a single video too lengthy. This video is available free of cost. However, if you want to save time and study from a well-organized PDF, you can purchase it at just 25. Preparing this PDF requires considerable time and effort, so they are priced at a very nominal amount. To get the PDF, simply click the link to the Telegram group provided in the bio. Once you join the group, you will find all the necessary details there. Now, without further delay, let's begin with Nagaland current affairs for June 2026. Choose life, a drug-free Nagaland. This is an important topic because it is not only relevant for the current affairs, but it is also a part of your main syllabus. Every year on 26th of June, the world observes International Day Against Drug Abuse and Illicit Trafficking. On this occasion, Nagaland also reaffirmed its commitment to building a drug-free society under the Nasha Mukt Bharat Abhiyan. So it was held under the global theme World Drug Problems, Persisting Issues, New Challenges, Innovative Responses. Now, this theme itself tells us that drug abuse is not a new problem. It has existed for many years. However, new challenges such as synthetic drugs, online networks, and cross border trafficking require innovative solutions instead of traditional approaches. One of the most important development is that the DGPs of all northeastern states have come together to prepare a common strategy against drug trafficking. Okay, this is important because drug traffickers they do not operate within one state. They move drugs across several states. So if only Nagaland takes action while neighboring states do not coordinate, traffickers can simply change their routes. For example, many narcotics enter India from Myanmar through Manipur or Mizoram, and then pass through Nagaland, and finally move towards Assam and other parts of the country. So instead of working separately, all the northeastern states have now decided to share intelligence, conduct joint operations, and coordinate investigations. This means that it will become much more difficult for drug traffickers to escape from one state to another. According to Nagaland DGP Rupin Sharma, this coordinated strategy is expected to become operational very soon. Current drug situation in Nagaland. Now, why is Nagaland so vulnerable to drug trafficking? The biggest reason is geography. Because Nagaland shares an international boundary with Myanmar, and Myanmar is part of the Golden Triangle, okay, which includes Myanmar, Thailand, and Laos. So this Golden Triangle is one of the world's largest regions for illegal opium and synthetic drug production. So therefore, because of its location, Nagaland naturally becomes a transit route for drug trafficking. Most narcotics enter India through Manipur before reaching Nagaland and then moving to other states. Another important point is that around 5 to 6% of Nagaland's population is estimated to be affected by drug addiction. Although the police have been making large drug seizures, Nagaland DGP Rupin Sharma had clearly said that the fight against drugs cannot be won by police force alone. Families, schools, churches, village councils, NGOs, and society as a whole must participate if Nagaland wants to become drug free. This is very important takeaway from this topic. So this is another important development Kohima Drug Assessment reveals early addiction, high unemployment. The ARC Foundation, they conducted a drug assessment in Kohima. Although the survey included only 51 respondents, the findings gave us an idea about the current trend of drug abuse in Nagaland. One of the biggest findings was that the highest number of drug users belonged to the 21 to 25 years age bracket, followed by those between 17 to 20 years. So now what does this tell us? So it tells us that drug abuse is mainly affecting the youth, who should actually be contributing to the state's economy and development. Another worrying finding was that 49% of the respondents were unemployed. Okay. So this suggests that unemployment and substance abuse are closely linked. The survey also found that many people start using drugs at a very young age. Around 55% began between the ages of 16 to 20 years, while almost 29% started even earlier, between 11 and 15 years. So this clearly tells us that awareness should begin in schools, not after students become adults. Now, another important point from this report is the poly drug use. Okay, poly means many, right? So poly drug use simply means consuming more than one drug instead of relying on a single substance. So the report found that many respondents were using substances like sunflower, alcohol, marijuana, detroxypropoxipine, yaba, heroin, codeine, phosphate. Another alarming finding was that all participants had a history of injecting drugs, with 40% currently injecting daily. Among daily injectors, 63% reported injecting between 2 to 5 times a day. Now, why this is dangerous? Because sharing contaminated needles can spread diseases like HIV/AIDS, hepatitis B, and hepatitis C. So, drug abuse is not just a law and order problem, it is also a serious public health issue. Now, regarding overdose and misconception, the report also highlighted this major concern that many users did not know how to respond during a drug overdose. Around 25% had already experienced an overdose, yet more than half admitted that they did not know how to manage such emergencies. Even more concerning is that many believed in myths such as giving salt and lemon to treat an overdose. So one should remember that such practices have no scientific basis and can delay proper medical treatment. So this shows that awareness and health education are equally important along with law enforcement. So recently, Union Home Minister Amit Shah unveiled the Vision Document on Drug Control 2026 to 2029 at the 10th Apex Level NCORD meeting and launched the Online Drugs Disposal Fortnight campaign to destroy over 2.09 lakh kg of ceased narcotics worth more than rupees 6,000 crore. This document sets a national roadmap for the next 3 years. Okay, so try to go through this document. Okay, vision document on drug control 2026 to 29. So this vision document, it is based on four major pillars. Okay, enforcement, intelligence and operation, precursor and synthetic drug control, demand and harm reduction, and capacity building and coordination. So the first pillar is enforcement, which focuses on dismantling entire drug cartels instead of only arresting individual offenders. The second pillar is control of precursor chemicals and synthetic drugs, so that illegal drug manufacturing itself can be prevented. And then the third pillar is demand reduction, which includes expanding the Nasha Mukt Bharat Abhiyan, creating a drug-free campus, and increasing the number of de-addiction centers. And then finally, the fourth pillar is capacity building, where the government plans to strengthen forensic laboratories, improve the capacity of the Narcotics Control Bureau, and provide greater support to states. So kindly go through this vision document on drug control. So what is the way forward for drugs abuse? So the way forward should always be practical. Firstly, awareness programs should begin at the school level so that children understand the harmful effects of drugs before they are exposed to them. Secondly, employment opportunities and skill development should be increased because unemployment is one of the major reasons behind substance abuse among young people. Thirdly, border management should be strengthened by using better surveillance technology and improving coordination between the northeastern states and the central agencies. Fourth, more de-addiction and rehabilitation centers should be established so that addicted individuals receive proper treatment and can integrate into society. And finally, combating drug abuse should become a community movement. Families, churches, village councils, educational institutions, NGOs, and government agencies, they must work together. Drug abuse cannot be eliminated by police action alone, as said by DGP Rupin Sharma. So the key takeaway from this topic is that drug abuse is not just a crime. It is also a social, health, economic, and national security issue. Therefore, the solution must be comprehensive. We need strict law enforcement, stronger border security, public awareness, quality rehabilitation services, and active community participation. Only when all the stakeholders work together can Nagaland truly move towards the vision of a drug-free society. Remember that the fight against drugs cannot be won by enforcement alone. It requires equal emphasis on prevention, rehabilitation, awareness, and community participation. Now let us move on to our next topic, which is NFHS 6, or the National Family Health Survey. So this is one of the most important surveys conducted in India. So from the examination point of view, you should always remember that whenever questions related to health, nutrition, fertility, or immunization are asked, National Family Health Survey becomes an important source of data. Now the good news is that Nagaland has shown significant improvement in maternal and child health indicators compared to the previous National Family Health Survey 5. Now, before discussing the findings, let us first understand what National Family Health Survey is. So, the National Family Health Survey, it is conducted by the Ministry of Health and Family Welfare with the International Institute for Population Sciences, Mumbai, serving as the nodal agency. So, this survey, it collects data on maternal health, child health, nutrition, immunization, fertility, family planning, and many other health indicators. Since it is conducted across almost every district in the country, the government uses this data while formulating health policies. Now, coming to Nagaland, one of the biggest improvement is in the antenatal care, which means that the health care that a woman receives during pregnancy. So more women are now registering for antenatal care during the first trimester, and more pregnant women are completing at least 4 antenatal checkups than before. So if we compare this data for 6 and 5, you can see the improvement. So why this is important? Because regular checkups helps detect complications early, reducing both maternal and infants' death. Now, another encouraging improvement is in the institutional deliveries. Now, if you see here, there's an improvement in institutional deliveries. Now, more mothers are giving birth in hospitals and healthcare centers instead of at home. So, this is extremely important because trained doctors and nurses are available during emergencies, making childbirth much safer for both the mother and the baby. Similarly, the number of deliveries assisted by skilled health personnel has also increased. If you see here, another positive trend is that more mothers and newborn babies are receiving postnatal care within the first 2 days after delivery. So if you compare this data here, you can see another improvement. Remember that the first 48 hours after childbirth are considered the most critical period for both the mother and the newborn. Okay. Now let's come to child immunization. So this survey shows that the percentage of fully vaccinated child has increased. So if you see this data here, you can see improvement. So coverage has also improved for vaccines such as polio. If you compare this, it has improved. Pentavalent, it has improved. Hepatitis B improved. Rotavirus vaccine improved. So this indicates that the government immunization programs are gradually reaching more children. However, there is one important point we should not ignore. Although Nagaland has improved considerably compared to National Family Health Survey 5, many indicators are still below the national average. So this is the national average, though it has improved from National Survey 5 to 6, okay? But it is still below the national average. So from here, what we can understand is that while progress is encouraging, there is still a long way to go for the state of Nagaland. So one of the interesting facts is that India's universal immunization program, okay, it is one of the largest immunization program in the world, providing free vaccines to millions of children every year. Now, going through both this data, it tells us two things. First, government interventions are working because more mothers are accessing hospitals and healthcare services. Second is that despite these improvements, accessibility and quality of healthcare still needs strengthening, especially in remote and rural areas. So the health system is improving, but it has not reached the desired level. So Nagaland's health indicator shows us that healthcare access is improving, but the challenge now is to ensure equitable and quality healthcare for every mother and child. So you have take note of this, okay? This was the sixth round of India's flagship nationwide health survey, and it covered nearly 6.7 lakh households across 715 districts. But this survey was not conducted for Manipur. Okay, so Manipur was excluded from this survey. Nagaland has recorded substantial improvements in key child nutrition indicators according to the latest National Family Health Survey 6, with marked reductions in major measures of undernutrition among child under 5 years of age. This is another important topic from the National Family Health Survey 6 report, which is child nutrition. So, whenever we talk about nutrition, remember one simple fact: a healthy child today means a productive workforce tomorrow. That is why nutrition is directly linked with economic development. So, according to the National Family Health Survey 6, Nagaland has shown remarkable improvement in child nutrition indicators, especially among children below 5 years of age. So one of the biggest achievement is the reduction in stunting. So what is stunting? Stunting simply means a child is shorter than expected for his or her age because of long-term undernutrition. So it reflects chronic malnutrition. So this survey, it also shows a decline in wasting, which refers to children who have low weight for height due to recent illness or lack of food. So you can compare the data. The percentage of the underweight children has also declined. All these are positive signs because they indicate better nutrition and improved healthcare. However, there is one important issue highlighted by the survey. Although undernutrition is declining, overweight children are slowly increasing. So if you see here, during the National Family Health Survey 5, it was at 4.9 and now it has increased to 6.2. So this means Nagaland is now facing what experts call the double burden of malnutrition. So, double burden of malnutrition, it means that undernutrition and overnutrition they exist together in the same population. This is becoming a major challenge across many developing countries. So, this survey also studied child feeding practices. You can see here in this, although there has been improvement, the percentage of child receiving an adequate diet is still quite low. This means that many children are still not getting balanced nutrition during the first 2 years of life. Causes of diarrhea and acute respiratory infection have also declined. So this indicates better healthcare services, improved sanitation, and increased awareness among parents. However, another interesting finding is related to adults. The survey found that some adults are underweight while many adults are overweight or obese. So it also recorded high prevalence of hypertension. So today, Nagaland is not only dealing with infectious diseases, but also with non-communicable diseases such as hypertension, obesity, and diabetes. So this is an important health transition taking place in the state. So it tells us that nutrition programs like Poshan Abhiyan, immunization, and maternal health care are producing positive results. However, dietary diversity awareness and lifestyle related diseases are becoming the next major challenge. So, Nagaland is gradually overcoming undernutrition, but it must now address the emerging challenge of the double burden of malnutrition. Despite being officially designated a dry state, Nagaland under the Nagaland Liquor Total Prohibition Act 1989, alcohol consumption in Nagaland continues to exceed the national average according to the latest National Family Health Survey 6. Nagaland is officially a dry state under the Nagaland Liquor Total Prohibition Act 1989. So, dry state simply means that the sale and consumption of alcohol are legally prohibited. However, despite being a dry state, this latest NFH S6 data shows that alcohol consumption in Nagaland remains higher than the national average. So, this tells us that merely making laws is not enough. Effective implementation and behavioral change are equally important. Now, according to this survey, around 26.9% of men, okay, and 1.6% of women reported consuming alcohol. So this data is only for men. So both the figures are higher than the national average. So this survey shows that the alcohol consumption has increased slightly compared to the National Family Health Survey 5. So similarly, the use of tobacco, if we see this here, has also increased. This shows that more than half of the men in Nagaland reported using some form of tobacco. So remember that tobacco is one of the leading causes of cancer, heart disease, stroke, and chronic respiratory diseases. Therefore, tobacco use is not just a personal habit but a major public health concern. Now, one question arises. If Nagaland has prohibition, why is alcohol consumption still high? So there can be several reasons. Illegal supply networks, weak enforcement, traditional and social acceptance in certain communities, cross-border availability, lack of awareness regarding the long-term health effects. Therefore, prohibition alone cannot solve the problem. Awareness campaigns, counseling, and rehabilitation and community participation are equally important. According to World Health Organization, okay, tobacco kills more than 8 million people globally every year. So it is considered one of the leading preventable causes of death in the world. So what does this figures tell us about Nagaland's health system? It tells us that while healthcare services are improving, preventive healthcare and behavioral change programs still require greater attention. Health is not only about treating disease, but also about preventing unhealthy habits. National Family Health Service 6 findings, it highlights that public health depends not only on legislation, but also on awareness, behavioral change, and effective implementation. See section search in private facilities in Nagaland. So this here, it is about the rise in the cesarean section or C-section deliveries in Nagaland. So what is C-section? So C-section, it is a surgical procedure that is used to deliver a baby when a normal vaginal delivery could put either the mother or the baby at risk. So in such situations, a C-section is life-saving and medically necessary. However, problems arise when C-sections are performed without any medical necessity. As you can see here, cesarean section deliveries in Nagaland have nearly doubled over the past 5 years, according to the National Family Health Survey 6, with deliveries in private health facilities significantly exceeding the benchmark recommended by the World Health Organization. So this is the benchmark, okay, set by WHO. So this does not mean that C-sections are bad. In fact, they save thousands of lives every year. So the concern is whether every surgery is actually medically justified. Now, if you look at the data here, about 9.9% of birth in Nagaland are delivered through C-sections. So this is still lower than the national average of 21.5%. But when we specifically look at private hospitals, the picture changes. Nearly 32.5% of the deliveries are conducted through C-sections in private hospitals. So We have to remember this figure because it is much higher than the World Health Organization recommended rate of 10 to 15%. So this naturally raises an important question. Why are C-section much more common in private hospitals? There could be several reasons. Sometimes pregnancy are genuinely high risk. Sometimes patients themselves prefer a planned delivery. However, experts also point out that financial incentives, convenience in scheduling deliveries, and defensive medical practices may also contribute. So, this issue is not only about medicine but also about medical ethics and healthcare regulations. Another positive point from the survey is that institutional deliveries have increased significantly. So institutional deliveries have increased from 45.7% to 88.6%. So this shows that this shows that more women are giving birth in hospitals and more deliveries are being attended by skilled health professionals. So this is definitely a positive development because it reduces maternal and infant mortality. So looking at this data, it tells us that access to institutional healthcare is improved, which is a positive sign. However, it also shows that healthcare quality and ethical medical practices need continuous monitoring, especially in private healthcare sector. Healthcare should always be patient centered, okay, not profit centered. So the objective is not to reduce the C-sections at all costs, but to ensure that C-section delivery is medically justified, evidence-based, and in the best interest of the mother and child. Nagaland has improved its performance in the Government of India's Performance Grading Index 2.0 for 2024 to 25, moving up from Akankshi 2 category in 2023 to 24 to Akankshi 1 in the latest assessment of the school education across states and union territories. So this performance grading index, it is prepared by the Ministry of Education to assess the performance of school education across all states and union territories. So it is an assessment of how well a state's education system is functioning. So PGI evaluates states and union territories across 6 domains. Okay, so the 6 domains are learning outcomes, access infrastructure and facilities, equity governance processes, and teacher education and training. So a total of 70 indicators are used and there is a maximum score of 1000. Okay, so these are important points from exam perspective. So these are the Nagaland district-wise PGID performance. So you can go through this list. So Nagaland score was 536.6 and Nagaland was placed in the Akankshi 1 grade band. So the grade band for Akankshi 1 is 521 to 580 points. So the state was among the 15 states and UTs in this category, while only Chandigarh and Punjab reached the highest performing category attained this year, that is Parcheshta 1. And in terms of grades across individual domains, Nagaland attained Akankshi 1 in learning outcomes, Pracheshta 1 in access, Pracheshta 3 in infrastructure and facilities, Uttam 1 in equity, and Pracheshta 1 in both governance and processes and teacher education and training. So let's see, you can go through this table here. So among the 6 domains, equity emerged as Nagaland's strongest area, indicating comparatively lower disparities in educational access and outcomes across different groups. So this shows that the overall governance infrastructure, teacher training, and learning outcomes have improved compared to previous years. So now the bigger challenge is to maintain this momentum and further improve the quality of education, especially in rural and remote areas. Guwahati High Court Kohima bench has directed the Nagaland government to ensure that every district in the state has at least one blood storage center or blood bank and to increase the availability of specialists in blood transfusion services. So the Guwahati High Court at Kohima bench has directed the Nagaland government to ensure that every district has at least one blood storage center or blood bank. This is important because blood is one of the few medical resources that cannot be manufactured artificially. So it can come only through voluntary blood donors. So therefore, whenever there's a medical emergency, hospitals must have safe blood readily available. So according to the information submitted before the court, Nagaland currently has only a limited number of licensed blood centers and blood storage facilities. You can see here in this table. So if you see this, many districts, as a result, still face shortages during emergencies. So the court has also directed the government to increase the availability of specialists trained in blood transfusion services. This is important because simply storing blood is not enough. Safe blood collection, testing, storage, and transfusion all require trained professionals. So this direction by the High Court highlights an important gap in Nagaland's healthcare system. Healthcare is not only about doctors and hospitals, it is also about ensuring that essential services like blood banks, laboratories, ambulances, and emergency care are available throughout the state. So World Blood Donor Day, it is observed annually on 14th of June, and this year theme is One Drop of Humanity Gives Blood, Save Lives. So this was first observed on 14 June 2004 in South Africa. So this theme highlights that one voluntary blood donation can save multiple lives. Also, remember that a single unit of donated blood can be separated into red blood cells, plasma, and platelets, meaning that one blood donation can potentially help up to three different patients. So, that is why voluntary blood donation is considered one of the greatest humanitarian acts. Nagaland bans all tobacco and nicotine based products for 1 year with effect from June 2nd, 2026 till June 1st, 2027. So the prohibition has been issued in the interest of public and in compliance with the Food Safety and Standards Prohibition and Restriction on Sales Regulation 2011, as well as directions of the Supreme Court of India and the Food Safety and Standard Authority of India. So, what is banned? Manufacture, processing, packaging, storage, transport, distribution, and sale of food products containing tobacco or nicotine applies to all such products, whether chewable or otherwise, flavored, scented, or mixed with additives, includes gutka, palm masalas, flavored or scented food products, and other chewable products containing tobacco or nicotine. Okay, so containing only tobacco or nicotine is banned. Covers products sold packaged or unpackaged as a single product or as a separate product marketed in a way that facilitates mixing by consumers. Extends to all food products containing tobacco or nicotine, regardless of the name under which they are sold in Nagaland. Nagaland observed National Immunization Day on June 28 with a target to administer oral polio vaccine to 143,530 children under the age of 5 across all districts. So this campaign, it is part of India's nationwide effort to sustain its polio-free status, which the country has maintained since 2014. So every child below 5 years of age must receive 2 drops of oral polio vaccine, irrespective of previous vaccination status, to protect against the crippling effects of poliomyelitis. To ensure no child is missed, health workers will mark the left little finger of each child with indelible ink that is non-toxic after administering the vaccine. This simple step helps track coverage and guarantees that every child receives protection. So Nagaland has remained polio-free since 1997 and India has remained this status since 2014. Okay, so remember these years. But we have to also remember that just because a disease has been eliminated from the country does not mean it has disappeared from the world. So polio still exists in few countries. Due to international travel and migration, the virus can re-enter any country if vaccination coverage decreases. So that is why every child below the age of 5 is given 2 drops of oral polio vaccine, irrespective of whether the child has already been vaccinated before. So this is called maintaining herd immunity. So when almost every child in a community is vaccinated, the virus cannot spread easily, thereby protecting even those who are too young or medically unable to receive vaccines. Another interesting practice you may have noticed is that after giving the vaccine, health workers mark the left little finger of every child with indelible ink. So this is done simply to ensure that no child is missed and no child receives the vaccine twice during the campaign. Now, what is polio? So, polio is short for polymyelitis. It is a highly contagious viral disease and it is caused by poliovirus. So it primarily affects young children and can result in lifelong paralysis, disability, or even death in severe cases. So polio is transmitted through contaminated water, food, or contact with an infected person. So the types of polio are paralytic polio, and post-polio syndrome. So oral polio vaccine, it was developed by Albert Sabin. So there are two types of vaccine. One is oral polio vaccine. So this one is the oral polio vaccine and inactivated polio vaccine. So one thing we have to remember is that there is no cure for polio. Prevention through vaccination is the only effective protection. So India was once considered as one of the countries with the highest number of polio cases in the world, but through continuous vaccination campaigns like Pulse Polio, India successfully eliminated the disease and became polio-free in 2014. So this is often regarded as one of India's greatest public health achievements. So even after eliminating a disease, government must continue surveillance and vaccine programs so that the disease does not return. State TV Forum Nagaland flags critical gap in Nikshay Mitra initiative. With only 497 of the 2,359 of active TB patients in Nagaland currently receiving nutritional support under the Nikshay Mitra initiative, the state TB Forum Nagaland called for strengthening the program through greater participation of elected representatives. Presently, the state has approximately 4,053 TB patients, while only 1,327 local Nikshay Mitras have enrolled so far, leaving a critical gap in patient support. So, Nikshay Mitra initiative, it is to ensure additional diagnostic, nutritional, and vocational support to those on TB treatment. And Nikshay Mitra are those who can support by adopting health facilities, block or urban wards, district states for accelerating response against TB to complement government efforts. So regarding TB is an infectious disease caused by Mycobacterium tuberculosis, and it commonly affects the lungs, but it can also affect other parts of the body. So it is a treatable and curable disease. So TB is spread from person to person through the air. When people with lung TB cough, sneeze, or spit, they propel the TB germs into the air. So Basil Calmette urine BCG is a vaccine for TB disease. So here, the state TB from Nagaland has pointed out that there is a major gap in the implementation of the Nikshay Mitra initiative. At present, Nagaland has around 4,000 TB patients, but only few of them are receiving the nutritional support under the Nikshay Mitra program. So this means that many patients who require additional nutritional assistance are still not receiving it. So remember that TB is not only a medical problem, but also a nutritional and social problem. A person who is suffering from TB needs proper nutrition because the body requires adequate nutrients to recover and respond effectively to medicines. So that is why the government had launched the Nikshay Mitra initiative, where individuals, companies, NGOs, and institutions can voluntarily support TB patients by providing nutritional assistance. Anup Kinchi, Commissioner of Secretary for Health and Family Welfare Nagaland, informed that the forum would write to Chief Minister of Nagaland seeking support for elected representatives for TB patients in the state and to Oil India Limited for nutritional support under its corporate social responsibility initiative. So under the Nikshay Mitra scheme, corporate donors can adopt patients by sponsoring a monthly nutritional food basket costing of rupees 1,000 per patient, and the minimum commitment period is 6 months and may extend up to 3 years. Now, despite this gap, there is also good news. Nagaland has recorded a 19% reduction in TB incidents and a 18% reduction in TB related deaths between 2015 to 2023. So this clearly shows that the government efforts are producing results. Under the TB Muk Free Panchayat initiative, 214 villages in Nagaland have claimed TB-free status, while a total of 505 TB Shivir camps were organized across the state, recording a footfall of 30,926. So this is about the state TB from Nagaland. So it comes under the National TB Elimination Program. So I want to share a real life example. And I believe that some of you have experienced this or you have come across this situation. So recently, an individual I know was diagnosed with TB. But instead of informing people and taking proper precaution, that individual had requested his friends or family members and or maybe relatives, okay, not to tell anyone because that individual felt embarrassed. Unfortunately, this is something that we still see in many parts of our society. Many people think that having tuberculosis is something to be ashamed of. But we have to remember that TB is just like any other disease. It is treatable and curable. There is absolutely no reason to feel ashamed. In fact, hiding the disease is much more dangerous than talking about it openly. Why? Because TB spreads through the air. So when a person with active lung TB coughs, sneezes, laughs, or even talks loudly, tiny droplets carrying the bacteria can spread into the air. So if the disease remains undiagnosed or untreated, people living nearby are at greater risk of infection. So instead of hiding the illness, the correct approach is to visit a doctor early, start treatment immediately, and follow the doctor's advice. At the same time, society also has a responsibility. We should never treat TB patients as outcasts. Many patients already suffer physically, mentally, and emotionally. If society begins to isolate or discriminate against them, they may delay treatment or hide their illness, which only makes the problem worse. So instead, we should encourage them, support them emotionally, help them complete their treatment, and spread awareness that TB is completely curable if diagnosed early and treated properly. So this is where awareness becomes as important as medicine. A person with untreated active TB can infect around 10 to 15 people in a year through close and prolonged contact. So, this is why early diagnosis and complete treatment are extremely important. So, from this passage here, it tells us that the government's TB control program is making progress. The bigger challenge is nutrition, public awareness, social support, and removing the stigma associated with TB. A strong health system must treat both the disease and the social barriers that prevent people from seeking timely care. So, eliminating tuberculosis requires more than medicine. It requires good nutrition, early diagnosis, community participation, and above all, the removal of stigma associated with the disease. So Nagaland had mandated four stream waste segregation. Okay, so this is mandatory. So the color coded system for waste streams as per the guidelines, as per the solid management rules 2026. Okay, there are four streams segregation of solid waste at its source. That is wet waste, dry waste, sanitary waste, and special care waste. So wet waste, it includes kitchen waste, food scraps, vegetable peels, flowers, and biodegradable items, and it should be kept in green bin. Dry waste, it includes plastic, glass, metal, rubber, and non-biodegradable items, and it should be kept in blue bin. Sanitary waste, it includes used diapers, sanitary towels or napkins, tampons, condoms, incontinence sheets, and sanitary pads. It should be wrapped securely in the pouches provided by the manufacturers or brand owners of these products or in a suitable wrapping material as instructed by the local bodies or authorities and shall place the same in the sanitary waste bin separate from bins meant for dry waste or wet waste or special care waste. Special care or household hazardous waste means and includes discarded paint drums and paint cans, pesticide cans or containers or bottles, compact fluorescent lamp or bulbs, tube lights, expired medicines, broken mercury thermometers, waste batteries, used or waste needles and syringe, contaminated gauge, cleaning agents, insecticides, expired medicines, and electricity bulbs or any other waste generated at the household level as notified by Central Pollution Control Board from time to time. So here it is regarding PM Vishwakarma scheme. So in a move aimed at strengthening livelihood opportunities for women artisans trained under PM Vishwakarma scheme. the Department of Women Resource Development, the Department of Industries and Commerce, and Mother's Craft signed a memorandum of understanding for the production, promotion, and marketing of artisans' products in Nagaland. So the agreement seeks to create sustainable market opportunities for products crafted by members of Mother's Craft through institutional support and enhanced market access, including sales through MyKey, the marketing platform and retail outlet of the Women Resource Development Department. So here we have to know about PM Vishwakarma scheme. It is a central sector scheme and it was launched on 17 September 2023 by PM Narendra Modi to provide end-to-end support to artisans and craftspeople who work with their hands and tools. So this scheme covers artisans and craftspeople engaged in 18 trades. Okay, so remember this. So currently, six traditional trades have been identified for training programs in Nagaland, and as of 25th of May 2026, a total of 1,939 artisans have been trained under PM Vishwakarma. So Eco Warriors Nagaland and Nagaland Zoological Park, Rangabar, has signed a memorandum of understanding to establish a collaborative partnership focused on biodiversity conservation, environmental education, scientific documentation, and community engagement. So this partnership will involve technical support from Eco Warriors Nagaland in tree taxonomy and biodiversity documentation within the zoological park, including identification and scientific documentation of tree species and other flora. One of the most important current affairs from Nagaland is related to MSME, which stands for Micro, Small and Medium Enterprises. So during the celebration of World MSME Day, Chairman of Nagaland Industrial Development Corporation, Huvulu Lorin, described MSME as the engines of daily lives in Nagaland. So World MSME Day, it is observed on 27 June, and this year's theme was Empowering MSME Through Innovation and Sustainable Industrial Development. So about this statement, that is MSMEs as engines of daily lives in Nagaland. So this statement is absolutely true because MSMEs are not just businesses, they are the foundation of the state's economy. They generate employment, encourage entrepreneurship, support local artisans and farmers, and help preserve Nagaland's unique indigenous products. So whether it is handloom, handicrafts, or food processing, bamboo products, or organic farming, MSMEs are driving innovation at the grassroots level. An interesting fact is that across India, MSME they contribute nearly 30% of the country's GDP, around 46% of total exports, and provide employment to more than 11 crore people. So, this clearly shows why the sector is often called the backbone of the Indian economy. So, to strengthen this sector, the government has launched RAM, that is Raising and Accelerating MSME Performance Scheme. So, this is a World Bank supported initiative of the Ministry of MSME, and it was launched in Nagaland in 2024. The objective of this scheme is to improve business capabilities, expand market access, make finance more accessible, and help local enterprises become sustainable and competitive. And the results have been quite encouraging. Around 49,000 MSME have directly benefited from the RAMP initiative, while more than 35,000 entrepreneurs have been trained and 30,000 women entrepreneurs have received targeted support. In addition, more than 882 focus workshops and awareness programs have been organized across all districts of Nagaland. Another important initiative is the Naturally Nagaland initiative. So it is a flagship program under the RAM scheme, and its aim is to strengthen the branding and marketing of products made in Nagaland by bringing different stakeholders together on a single platform. So this not only improves market access but also increases the visibility of local products at a national and international level. So going forward, Nagaland should focus on digital marketing, e-commerce, access to affordable credit, better logistic and skill development, encouraging startups, promoting women entrepreneurs, and strengthening initiatives like One District, One Product and Make in India can further boost the MSME ecosystem with proper policy support. MSME can become a major driver of employment and economic growth in the state. So MSME's impact on India's economy: 31.1% share in GDP, 35.4% share in manufacturing output, 48 38.58% share in exports and 38.99 crore employment generated. So this is according to PIB, okay? The source is Ministry of MSME. So MSME is the second largest employer after agriculture. So this is very important. The employee state insurance scheme has come into force across all 17 districts of Nagaland from November 1st, 2025, making it mandatory. So this is mandatory for all factories and establishments employing 10 or more persons with monthly wage up to rupees 21,000, rupees 25,000 for persons with disability to register under the ESI Act 1948. So this scheme applies to all employees in factories, shops, hotels, and restaurants, road transport, newspaper establishments, educational institutions, medical institutions, casual or contractual workers employed by municipal bodies, corporations, or central government entities, contractors employing 10 and above workers, implementing NGO or agency, charitable trusts, and other establishments as notified. So all regular, casual, or contractual workers are eligible. The Labor Department has cautioned that failure to register will attract penalties and legal notices under Section 85 of the ESI Act 1948. The Directorate of Higher Education and Directorate of Technical Education, Government of Nagaland, on June 9 had signed a memorandum of understanding to strengthen collaboration in skill-based and vocational education across higher education institutions in the state. The partnership aims to promote resource sharing, capacity building, certification mechanism, and enhance employability opportunities for students through the introduction of emerging and industry relevant courses, including AI, convergence technologies, and other skill oriented programs. So, this initiative it reflects the government's commitment to fostering innovation, enhancing employability, and creating greater opportunities for youth through interdepartmental cooperation and effective utilization of existing educational resources. Naga Ed and NIPIT, which stands for Nagaland Empowerment of People through Economic Development, had signed a 5-year memorandum of understanding in Kohima to collaborate in areas including digital education, renewable energy market development, research capacity building, and community knowledge systems. So NIPET, it is a Government of Nagaland initiative focused on community-based natural resource management, renewable energy development, and sustainable livelihoods. It operates CERES in Dimapur, a facility dedicated to renewable energy research, innovation, manufacturing, and training. And Naga Ed, it is headquartered in Kohima, and it develops digital learning solutions, capacity building programs, and technology enabled systems for educational and institutional development across Northeast India. The Department of Youth Resources and Sports, Government of Nagaland has launched two important initiatives, that is mentorship for holistic development of student athletes and skill-based economic sustenance program for athletes of Indira Gandhi Stadium Academy, Kohima. So Business Association of Nagas and AICIL had signed pact to expand insurance awareness. At the 13th annual general meeting of VAN at East Base Nagaland on June 18, the signing of a memorandum of understanding between the Agricultural Insurance Company of India Limited and BAN took place to foster collaboration in expanding insurance awareness and outreach across Nagaland, particularly in agriculture and allied sectors. Nagaland police bars FIRs in routine loan business disputes, directs parties to civil remedies. One of the most significant legal developments in Nagaland recently is the decision of the Nagaland police to stop registering FIRs in routine loan recovery and business related disputes. At first glance, many people may think that this decision weakens the rights of lenders. However, that is not the case. In reality, this step it aims to ensure that civil disputes are treated as civil matters, while criminal law is reserved only for genuine crimes such as fraud or cheating. And one of the important takeaways is that FIR is registered only in case of cognizable crimes. Okay, so this was one of the question which was asked in the recent UPSC exam also. So understanding the concept of FIR is also important. So this decision has become partly important because in recent years, Nagaland has witnessed a rise in disputes related to private money lending, delayed loan repayments, and business transactions. So many of these disputes were being converted into criminal cases by filing FIRs, even though they were essentially contractual disagreements. So the Nagaland police has issued fresh statewide instructions that FIRs should not be registered in purely civil and commercial disputes. So this include recovery of business deals, trade credit disputes, pending private loans, breach of contracts, ordinary loan repayment disputes. An FIR should only be registered if there is clear evidence that the borrower had a dishonest or fraudulent intention right from the very beginning. In simple words, if someone borrowed money with the intention of cheating from the very first day, then it becomes a criminal matter. But if a person genuinely borrowed money and later become financially unable to repay, it is primarily a civil dispute, not a criminal offense. So this distinction is also in line with the Bharatiya Nyaya Sanhita, which replaced the Indian Penal Code. Mere non-payment of a loan or breach of a contract does not automatically amount to cheating or criminal breach of trust. So this decision has become necessary because many people in Nagaland depend on private money lenders for urgent financial needs. So let us consider a common example. Suppose a farmer needs money immediately for cultivation, or a student requires money to pay college fees, or a small shopkeeper needs capital to restart his business. Government schemes and bank loans are available, but they often involve documentation, verification, collateral, and approval procedures that take time. So private money lenders, on the other hand, they provide money almost instantly. Because of this convenience, many people they choose private loans despite the fact that they often carry very high interest rates. However, problems arise when borrowers fail to repay due to financial difficulties. In several cases, lenders immediately approach the police and they try to register an FIR. So this creates fear and unnecessary criminal proceedings, even though the dispute is actually contractual in nature. So Nagaland police, they want to prevent this misuse of criminal law. So the police has also referred the Nagaland Money Lenders Act 2005. So according to this act, failure to repay a loan is not a criminal offense. And if money lenders violate the law by operating without a license or charging illegal or excessive interest, action can be taken against them. Such matters are mainly handled by designated inspectors and civil courts. So in Nagaland, extra assistant commissioners have been designated as inspectors under the Act. So police have only a limited supportive role and cannot initiate criminal proceedings suo motu for routine debt recovery. So according to Nagaland Police, the guidelines are intended to protect bona fide businessmen, borrowers, and citizens from the harassment through frivolous criminal cases, reserve criminal law for genuine offenses involving fraud, and ensure that police are not used as recovery agents in private financial disputes. So the Nagaland Police has also issued specific instructions to every police stations. So first, the station house officers and officers in charge must personally examine every complaint involving loans, business transactions, or contracts. Second, if criminality is not immediately viable, the police must conduct a preliminary inquiry before registering any FIR. Third, if the matter is found to be purely civil, the complainant should be advised to approach the appropriate civil court instead of filing a criminal case. Fourth, police officers who violate these instructions by registering an FIR in a purely civil matter will face strict disciplinary action, including major penalty proceedings. And finally, copies of the circular must be displayed prominently in every police station for public information. So, if not an FIR, then what remedies are available? So, these are the alternative remedies available for the public. A lender can file a civil suit to recover the money, use a summary suit for faster disposal if there is written proof, go for arbitration if the agreement contains arbitration clause, file a case under the Negotiable Instrument Act 1881 for dishonored checks, and in case of bank loans, approach the debt recovery tribunals or other competent authorities. So these are the proper legal mechanisms for recovering money. So based on the current situation in Nagaland, this issue is becoming increasingly relevant because reports indicate that private money lending has become common in many parts of Nagaland. So many individuals, they borrow money for education, healthcare, family functions, business investments, or emergencies. Unfortunately, some borrowers become trapped in a cycle of debt because they have to pay very high monthly interest, making it difficult to repay even the principal amount. At the same time, there are also genuine lenders who lend their savings and face financial losses when borrowers deliberately refuse to pay. So, therefore, both borrowers and lenders require legal protection. The objective of the recent police notification is not to favor one side over the other, but to ensure that the correct legal procedure is followed. So, going forward, the government should strengthen institutional credit so that people are less dependent on informal money lenders. Banks and government departments should simplify loan procedures, reduce unnecessary paperwork, and ensure quicker approval of small loans, especially for students, farmers, women entrepreneurs, and MSMEs. So, financial literacy programs should be organized across villages and urban areas so that people understand their legal rights, the risk of borrowing exorbitant interest rates, the importance of reading loan agreements carefully. So, strict action should also be taken against unlicensed money lenders and those charging illegal interest under the provisions of Nagaland Money Lenders Act 2005. The media, civil society organizations, churches, and educational institutions should also spread awareness so that people know the difference between a civil dispute and a criminal offense. As a responsible citizen, we should borrow only after assessing our repayment capacity. So before taking a private loan, we should always read the loan agreement carefully, verify whether the lender is legally authorized, avoid accepting unreasonable or exploitative interest rates, maintain proper written records of financial transaction. So if we face repayment difficulties, we should communicate honestly with the lender and seek legal remedies instead of allowing the dispute to escalate. Similarly, lenders should recover their money through lawful civil procedures rather than misusing criminal law as a pressure tactic. So, this Nagaland's police racing directive is an important step towards ensuring fairness, protecting citizens from unnecessary harassment, and preventing the misuse of criminal law. It reinforces the principle that not every financial dispute is a criminal offense. While fraud and intentional cheating must be punished strictly, ordinary loan defaults and contractual disagreements should be resolved through civil courts and other legal mechanisms. So, in the long run, a combination of financial awareness, easier access to institutional credit, responsible borrowing, and effective regulation of private money lending will help build a more transparent, legally sound, and financially secure society in Nagaland. The Pom community observed the 74th Pom Day on June 6th. So this day is important, so remember this day. In remembrance of June 6, 1952, when the elders of the Pom tribe made a pledge to stop the practice of headhunting and to live in peace with one another. Tafmon partners with Royal Welsh College for Music and Drama. Nagaland gets 4 incubation facilities for entrepreneurs and food processing. So Chief Minister Dr. Neferyu inaugurated 4 incubation facilities for entrepreneurs and food processing across Nagaland. The creation of the facilities, it is aimed at building a self-sustaining economy and transitioning the state from a consumer to a producer. So it is funded under New Delhi's SASKI scheme, that is Special Assistance to States for Capital Investment. So the project included the incubation center for food processing located within the state industrial area in Tuluvi, Dimapur, incubation center for entrepreneurs and infrastructure development at the Industrial Growth Center Ganesh Nagar Chumuktima, an incubation center for food processing in Tuinsang, and modern aggregation center in Blongnak Mokokchong. So in Dimapur, Jumkutima, Tuinsang, and Mokokchong. So these food processing plants, they are designed to operate on a farm factory market model to minimize crop wastage. And the food processing department, it was bifurcated from Department of Industries and Commerce. Okay. So the food processing department broader vision is to replicate this pilot model in every district before 2028. The Naga Photo Archive opened the exhibition of Another Time Naga Family Photos 1950s to 1990s at the Northeast Zone Cultural Center in Chumukatima. So this initiative emerged from a desire to understand Naga history through family albums and personal photographs. This foundation project it is implemented by India Foundation for the Arts and the under the Arts Practice Program supported by Tata Trust. So Amit Mahanti, documentary filmmaker, visual artist and photographer, and visual artist Zubeni Lotha are founders of the Naga Photo Archive. The 8th World Food Safety Day 2026, it was observed at Hotel Saramati with an urgent call to transform the burden of foodborne illness into actionable solutions. So it was held under the theme From Burden to Solution, Safe Food Everywhere. So this is the theme for World Food Safety Day. And World Food Safety Day is observed annually on 7th of June. A total of 84 women leaders representing various churches across Dimapur participated in Nari Leads Swachhata Faith-Based One-Day Action Summit, which was organized by Dimapur Municipal Council at Dimapur. So hashtag Stand With Her awareness campaign. It was held at Town Hall on Dimapur on June 9th. So this campaign was organized by the Dimapur Eastern Nagaland Students Union and Nagaland NGOs Forum and Nagaland Schools Alliance in solidarity with a 14-year-old victim of the recent reported rape case. So, Vyaktikram Education Conclave 9.0, it was held in Dimapur. The Naga Hospital Authority Kohima has been granted the National Muskan certification under the National Quality Assurance Standards, becoming the first district hospital in Nagaland to achieve the recognition. So, Nagaland Hospital Authority Kohima, Department of Pediatrics, secured an overall Muskan score of 93.11%. So Muskan is a government of India initiative which is aimed at improving the quality of child care up to 12 years of age, okay, in public health facilities. So remember the age, and it is for public health facilities through child-friendly healthcare services and measures to reduce preventable newborn and child morbidity and mortality. Mima Village wins Suposhit Gram Panchayat Abhiyan Award. So Mima Gram Panchayat of Kohima district has been conferred with Suposhit Gram Panchayat Abhiyan Award. The objective of this initiative is to incentivize Anganwadis in Gram Panchayats to achieve a benchmark level of infrastructure service delivery status and nutritional outcomes of beneficiaries. So it aims to mobilize and motivate Gram Panchayat and Anganwadi functionaries to take proactive measures towards eradicating malnutrition in the catchment area. Alimco to hold assessment distribution camps in Kohima. So Alimco, it stands for Artificial Limbs Manufacturing Corporation of India, and it is a central public sector enterprise under the Ministry of Social Justice and Empowerment. And Alimco will conduct assessment and distribution camps under Assistance to Disabled Persons Scheme and Rashtriya Bayoshri Yojana Scheme. So this initiative will benefit needy Divyanjan. Divyanjan means persons with disabilities and senior citizens aged 60 years and above across Kohima district. So regarding the scheme, ADIP scheme, it is in operation since 1981 and it provides financial assistance to persons with disabilities for purchasing aids and appliances. So this scheme it aims to promote physical, social, and psychological rehabilitation by providing assistive devices that reduce the effect of disabilities and enhance independent living. And regarding Rashtriya Vayoshri Yojana, it was launched in the year 2017 by Ministry of Social Justice and Empowerment, and it is a central sector scheme funded from the Senior Citizens Welfare Fund. So this fund was notified in the year 2016. All unclaimed amounts from small savings accounts PPF and EPF are transferred to this fund. For the assistance to disabled persons schemes, beneficiaries are required to produce a UDID card or enrollment number, a medical disability certificate indicating 40% disability or above, Aadhaar card, income certificate showing a monthly income not exceeding 22,500, or ration card and two passport size photographs. And for the RBY scheme, senior citizens who are aged 60 years and above must produce Aadhaar card, income certificate showing a monthly income not exceeding rupees 15,000 or BPL, ration card, or proof of receiving pension, along with two passport size photographs. So eligible beneficiaries have been requested to attend the camps with the necessary documents for availing the benefits. Okusa Toyota Kohima hosted Toyota Anime Matsuri Festival. Base Lishike, an alternative learning center located at Kimho under PKL Kohima village, was inaugurated by school education advisor Dr. Kekre Yome. The learning center has been established under the Center for Indigenous Knowledge and Alternative Learning Initiative of Dr. K.N.T. Keditsu Foundation. So this institution, it aims to integrate indigenous Naga knowledge systems with contemporary educational approaches grounded in critical pedagogy. The institution aims to contribute to the development of alternative educational models that are locally rooted, environmentally conscious, culturally responsive, and future oriented. Nagaland inaugurates Naga Indigenous Income Learning Center at Pisamaki, so remember this. The Department of Art and Culture, Government of Nagaland has inaugurated the Nagaland Indigenous Income Learning Center at Pisama Village in Kohima District. So this facility, it is aimed at preserving, promoting, and documenting Naga indigenous heritage and traditional knowledge systems. So this project was supported by Ministry of Development of Northeastern Region and the Northeastern Council. PIB Kohima hosts Varta on urban livelihoods entrepreneurship. So the Press Information Bureau Kohima under Ministry of Information and Broadcasting on January 29 organized a Varta on the theme 12 years of government from empowerment to prosperity, urban livelihoods and entrepreneurship at Kohima. So the program highlighted the transformative impact of the PM Swanidhi, which stands for Street Vendors Atmanirbhar Nidhi. So this scheme, that is PM Swanidhi, it is about empowering the street vendors through affordable collateral, free credit, and enhanced social security. The government guarantees the loan for them under Credit Guarantee Fund Trust for micro and small enterprises. So vendors who successfully pay back their second loan can get a special UPI linked pay credit card from rupees 10,000 to 30,000 for emergency needs. So regarding this scheme, we will discuss in detail in the later part of the video. So joining this scheme also opens the door to 8 other government welfare programs, including affordable life insurance, accident insurance, ration card benefits, student support, etc. So this scheme includes PM Suraksha Bima Yojana, PM Jivan Jyoti Bima Yojana, PM Shram Yogi Mandan Yojana, PM Jandan Yojana, One Nation One Ration Card, Janani Suraksha Yojana, registration under BOCW and PM Matru Vandana Yojana. To avail this benefits, the beneficiaries have to be enrolled through the Special Socio-Economic Profiling Drive called as Swanidhi Se Samriddhi SSS. The program also highlighted the achievements of Deen Dayal Antyodaya Yojana, National Urban Livelihoods Mission scheme in empowering the urban poor through sustainable livelihoods, skill development, and financial inclusion. So, since its implementation in Nagaland during 2014 to 15, DAY and ULM has focused on organizing the urban poor into self-help groups, promoting skill training and placement, supporting self-employment and micro enterprises, assisting street vendors, and providing shelter for the urban homeless. These interventions have strengthened livelihood opportunities and social protection across urban areas. 984 self-help groups are currently functional across 11 districts of Nagaland, creating sustainable income opportunities and reinforcing community-based institutions. So DAY-NULM has enabled beneficiaries to become self-reliant by facilitating access to skill development, credit support, and enterprise opportunities, thereby improving the livelihoods of women and economically weaker sections. So following the conclusion of the DUI-NULM on September 30, 2024, the Deen Dayal Jan Ajivika Yojana Sihari has been introduced by Ministry of Housing and Urban Affairs as its successor. Okay, so remember this point. The new mission is currently under implementation in a pilot phase following a test learn scale approach. So Kohima has been selected as one of the 25 pilot cities across the country for Deen Dayal Jan Ajivika Yojana Sihari. So this program adopts a targeted approach focusing on vulnerable occupational groups, including gig workers, transport workers, construction workers, waste workers, and care workers and domestic workers, while integrating skilled livelihoods and social protection. Nagaland holds first NEP aligned hands-on drone workshop for students. So the workshop was held at Kohima, okay, at Kitiman. So this is Nagaland's first workshop aligned with the National Education Policy 2020. Workshop was organized by the Directorate of Science and Technology, Government of Nagaland, in collaboration with the Southern Angami Students Union. So Dimapur district has been chosen as the model district under the Ayushman Bharat Digital Mission. The National Health Authority, in collaboration with the Directorate of Health and Family Welfare Nagaland, has organized a state-level inaugural workshop for the Model District and Model Facilities Initiative under the Ayushman Bharat Digital Mission, marking a major step towards strengthening the state's digital healthcare ecosystem. So the one-day workshop was held at Zone 92 by the Park Chumbukatima. So regarding the Ayushman Bharat Digital Mission, it was launched in September 2021, and the aim was to transform the healthcare delivery through a citizen-centric and digitally connected ecosystem. Ayushman Bharat Health Account, so it is a unique 14-digit number which is used to link all the health records of a person. So, Ayushman Bharat Health Account intends to create a digital health ecosystem and aims to promote digitization of healthcare. So, any individual can enroll in Ayushman Bharat Digital Mission to generate a health ID or ABHA free of cost. Nagaland completes all major RUSA 2.0 projects, says Inna Alon. So, Minister of Higher Education and Tourism Timjan Inna Alon announced that all major projects under the Rashtriya Uchatar Shiksha Abhiyan 2.0 in Nagaland have been completed while inaugurating the classroom upgradation project on the RUSA 2.0 at Fazal Ali College, Mugupchong. So he described he described this completion as the final nail of the scheme in the state. So Nagaland is one of the first states in the nation to complete RUSA 2.0 projects without any issues. So the classroom upgradation project was constructed at a cost of rupees 1.80 crore under RUSA 2.0. So RUSA 2.0 it is funded by the Ministry of Education. So under RUSA 2.0, a total outlay of rupees 84 crore was approved for 10 projects in Nagaland. Okay, so these are the 10 projects in Nagaland approved under RUSA. So Rashtriya Uchita Shiksha Abhiyan, it was launched in 2013 as a central sponsored scheme with an aim to provide funding to state higher educational institutions. So these are the list of the 10 projects under RUSA 2.0. An innovative youth health initiative of the Nagaland State AIDS Control Society, City Barn, the health center was launched in Mokokchong. So City Barn, Mokokchong, it is the fifth such center in the state, following the establishment of centers at Kohima, Dimapur, Woka, and Tuensang, while plans are underway to establish another center in Parent District. So the center aims to reach young people below the age of 24 by providing health-related information counseling and support services in a safe and confidential environment. This initiative, it is supported by Care and Support Society, which has undertaken the project under NSACS. Also, in a bid to overcome the geographical barriers and ensure HIV services reach the most inaccessible corner of the state, the Nagaland State AIDS Control Society has initiated the Health on Bike Reaching the Unreached. Toiching village, which was officially recognized in 2025, remains the only recognized village in Longland district yet to be electrified. So this was informed by the District Planning and Development Board. Parent Deputy Commissioner Hiazu Meru said Parent is the only planned model district headquarter in the state. Okay, so the district headquarter has a total area of 3,715.11 acres. So under the Northeastern Special Infrastructure Development Scheme, the road from Jaluki Pungchi to the district headquarter and the road from New Parent Village to Parent Town is under construction. The Parent District Planning and Development Board has recently declared the district headquarter as the Green District Headquarter, and accordingly, the same was communicated at the Urban Development Department. So Yapur had declared drugs and alcohol free village. So this Yapur village it is in Shamator district. In the observance of World Day Against Child Labor 2026 on June 12th, the District Child Protection Unit, Simenyu, in collaboration with the Tree Shelf Project, had organized a program under the theme Red Card to Child Labor, Fair Play for Children, Decent Work for Adults at DCPU office Simenyu. So this program, it reflected the importance of protecting childhood through access to education, opportunities, and safe spaces for learning. So according to Trinsong District Planning and Development Board, cyber fraud losses exceed rupees 11.33 crores since 2022. Lipit's Emporium in Trinsong aims to serve artisans of Eastern Nagaland. So the first emporium established by Nagaland Empowerment of People through Economic Development was inaugurated in Trinsong on June 23rd, marking a significant step towards improving market access for artisans and promoting indigenous products from Eastern Nagaland. So it was established with the support from the Ministry of Textiles, Government of India. The Emporium is expected to serve as a center for preserving traditional craftsmanship, promoting entrepreneurship, strengthening rural livelihoods, and expanding access to national and international markets. Agricultural and Processed Food Products Export Development Authority promotes passion fruit, banana, and ginger exports in Mocha. So from here, we have to just take note of Veda and about value addition. Kid Bachao Kid Abhiyan launch in Mocha. The Nagaland State Launching Program of the nationwide Khed Bachao Abhiyan. It was held at the Deputy Commissioner's Conference Hall, Wokha, on June 1st. So it was organized by ICAR Krishi Vigyan Kendra, Wokha. So this is a month-long campaign to promote soil health, balanced fertilizer uses, and sustainable agricultural practices. So this campaign it seeks to create awareness among farmers on scientific methods, reduce dependence on chemical fertilizers, and encourage environmentally sustainable agriculture. It also focuses on improved soil management, weather-based advisory services, and the promotion of organic farming practices. So this Kid Bachao Abhiyan, it was launched by Union Minister for Agriculture and Farmers Welfare and Rural Development, Shivraj Singh Chauhan, okay, from the Ramasiya village in Raisen district, Madhya Pradesh. So this Khel Bachao Abhiyan, it is a nationwide campaign and it is implemented from 1st June to 30th June 2026 with the core message, Save the Soil, Save Farming, Save Farmers. The fourth annual conference of the Toti Kiwi Cluster Level Federation under Nagaland State Rural Livelihood Mission was held at Pukuputo. So regarding Nagaland Rural Livelihood Mission, it is a registered society under Society Registration Act 1860 and Nagaland Societies Registration Act 2008. So it was established by the Rural Department, Government of Nagaland on 13 September 2012 for the implementation of DAY and RLM. So the governing body of the society is headed by the chief minister. Okay, so this is important. Minister of Rural Development and Chief Secretary of Nagaland as co-chairpersons. The new academic building of Zuniputo Government College was inaugurated by Minister for Higher Education and Tourism, Timjul Ina Along, on June 5th. So this project it was constructed under PM Usha. Okay, so PM Usha is important. So PM Usha is a central scheme to strengthen higher education institutions with the funding and collaboration from the Ministry of Education and the Government of Nagaland. Urgent rescued from media office released into wildlife sanctuary in Zalaputo. So it was released at the Lanki River in Bosu Wildlife Bird Sanctuary at Bukie village under Zalaputo district. The Northeastern Development Finance Corporation Limited, Kohima branch, in association with the Society of Ab Origins, Zuniputo organized Business Meet 2026, okay, at Zuniputo. So the emphasis of NetFi Business Meet 2026 were entrepreneurship and startup, skill or preparation, institutional support, government schemes, inclusive growth. The Krishi Vigyan Kendra Zuniputo under Nagaland University on June 12 organized an info distribution program under NABARD. Sponsored Farmer Support Program Fund project title Empowering Rural Women Through Karak- Karaknat Poultry Farming, a sustainable approach to livelihood and nutrition at Akuluto subdivision. So regarding Krishi Vigyan Kendra, it is a district level agricultural extension institution which was established by ICAR to bridge the gap between research and farmers. So it was introduced in the year 1974. So KVK, it aims to transfer agricultural technologies, empower farmers, and enhance productivity while promoting sustainable farming practices. So Dr. Mohan Singh Mehta Committee, appointed by ICAR in 1973, promoted the idea of the establishment of Farm Science Center, that is Krishi Vigyan Kendra in the country. So the first Krishi Vigyan Kendra was established in the year 1974 at Puducherry under the Tamil Nadu Agricultural University, Coimbatore. So these are some questions for you, so you can go through this. Satoi Range representatives attend Hollow Gibbon conservation training. So, 9 community representatives from villages under the Satoi Range in Nagaland are participating in a 6-day capacity building program on Hollow Gibbon conservation at the Holongapar Gibbon Sanctuary in Mariani, Assam. Okay, so remember this. And regarding some facts related to Hollow Gibbon, so scientific genus is Hollow. So species in India, Western Hologipon and Eastern Hologipon. So in distribution is Northeast India, Bangladesh, Myanmar, Southern China. So IUCN status for Western Hologipon is endangered, okay? And IUCN status for Eastern Hologipon is vulnerable. So you remember this, and it is in the Schedule 1 of the Wildlife Protection Act 1972. So flagship sanctuary, Holongapar Gibbon Sanctuary, Assam, and diet is frugivores with leaves, flowers, insects, and social structures, monogamous family groups of 2 to 6. So regarding this particular issue, on June 11, 2026, okay, the government of India, Assam, and Nagaland had signed a tripartite memorandum of understanding in New Delhi to restart oil and natural gas exploration in the disputed area belt along the Assam-Nagaland border. So exploration had remained suspended for nearly 3 decades because of the border dispute and law and order issues. So this agreement, it provides a framework for safe exploration, security of operations, and a 50-50 revenue sharing between Assam and Nagaland. So the center has projected it as an example of cooperative federalism and an important step towards India energy security. Now, if we look at only from the center's perspective, this appears to be a win-win agreement. But in Nagaland, the issue is much more complex. The first reason is Assam-Nagaland border dispute itself. The proposed exploration lies in areas where ownership is still contested. Therefore, many Naga civil society organizations argue that development cannot come before settlement of the boundary issue. Their concern is simple. If oil extraction begins before the dispute is resolved, it may indirectly strengthen territorial claims or create fresh conflicts over ownership of natural resources. The second and even more important issue is Article 371A of the Constitution. So remember this provision because it is unique to Nagaland. Article 371 states that no act of parliament relating to Naga religious or social practices, Naga customary law and procedure, administration of civil and criminal justice under customary law, and most importantly, ownership and transfer of land of its resources will apply to Nagaland unless the Nagaland Legislative Assembly decides to adopt it. So this means that unlike many other states, land and underground resources are traditionally considered to belong to the people and the communities, not automatically to the government. Therefore, whenever oil or mineral exploration is proposed, the consent and participation of the affected landowners, tribal bodies, village councils, and civil society organizations become extremely important. So that is why after the MOU was signed, several organizations and individuals they raised objections. Their argument was not necessarily against development or oil exploration itself. Instead, they cautioned the process. They demanded that the government should first clarify how Article 371 would be protected, how local communities would be consulted, how landowners would benefit, and whether exploration in disputed areas should begin before the border issue is finally settled. So today we have two different perspectives. The government perspective is that this agreement will unlock over 1,000 square kilometers of hydrocarbon-rich areas, attract investment, generate employment, increase state revenue, and strengthen India's energy security by reducing dependence on imported crude oil. And the second perspective is regarding the civil society's perspective is that economic development should not compromise constitutional protections, customary ownership of land, and or the or the rights of indigenous communities. So, according to civil societies, development must go hand in hand with constitutional safeguards and public consultation. So, the key takeaway from here is that this controversy is not simply about oil, it is about balancing three important objectives like economic development, constitutional protection under Article 371A, and a peaceful resolution of the Assam Nagaland border dispute. Nagaland and New Zealand joined hands for India's first Kiwi Center of Excellence. Nagaland has taken a significant step towards establishing India's first Center of Excellence for Kiwi at Kutsuro in Kohima district, Apek district. So, with the state government holding high-level discussions with the New Zealand delegation to advance the landmark bilateral project. So, the key objective of the visit is the installation of a weather monitoring station at the proposed Center of Excellence site in Futsiro. So, this station it will generate real-time data on weather conditions, soil health, and water parameters, providing crucial scientific inputs for precision farming and helping growers improve productivity and food quality. The proposed Center of Excellence it is expected to play a pivotal role in strengthening Nagaland's kiwi sector through scientific research, technology transfer, and capacity building. The initiative is in line with the state government's broader vision of positioning Nagaland as the Kiwi state of India, while creating better livelihood opportunities for farmers through modern science-based horticulture practices. NAPA joins National Convention on Niramaya Health Insurance. Members of the NAPAD, which stands for Nagaland Parents Association for the Disabled, participated in the Hitarth Sahayak National Convention 2026 held at Nagda, Ujjain, Madhya Pradesh on June 14, where stakeholders discussed strengthening the implementation of the Niramaya Health Insurance Scheme for persons with intellectual and developmental disabilities. So it was organized by Parivar NCPO in collaboration with VOSNP, a US-based organization. The convention brought together disability rights advocates, parent organizations, government officials, and development stakeholders from across the country. So discussions focus on the implementation of HITART scheme, which stands for Healthcare Initiative to Avail Rehabilitative Therapies and Health Coverage, the initiative of VOSAP and Parivar NCPO aimed at increasing enrollment and utilities of the Niramaya Health Insurance Scheme among persons with autism, cerebral palsy, down syndrome, intellectual disabilities, and multiple disabilities. So NAPAD serves as the nodal agency for implementing the HITART scheme in Nagaland. Okay, so remember this fact. And is working in collaboration with the Office of the State Commissioner for Persons with Disabilities to facilitate awareness, enrollment, and access to scheme across the state. So Nirmaya Health Insurance Scheme, it was launched by Department of Empowerment of Persons with Disabilities, Ministry of Social Justice and Empowerment, Government of India. So the objective of this scheme is to provide affordable health insurance to persons with autism, cerebral palsy, mental retardation, and multiple disabilities. So this scheme it provides insurance coverage up to rupees 1 lakh, which must be renewed annually after the financial year. So who are eligible? So all the disabled persons who have at least one of the disabilities under the National Trust Act 1999 with a valid disability certificate are eligible for this. So 73rd plenary of the Northeastern Council. So this was held at Shillong, Meghalaya. Okay, so just remembering this fact will be enough for this portion. But let's go through. So Governor of Nagaland, Nan Kishore Yadav, addressed the 73rd plenary session of the Northeastern Council on 4th of June 2026 at Shillong. He stressed regional cooperation, better connectivity, infrastructure investment, youth empowerment, and sustainable development for achieving Viksit Bharat F 2047 and Viksit Nagaland. So Amit Shah, our Home Minister, Union Home Minister, had chaired the 73rd Northeastern Council plenary session in Shillong. So this is another important fact. So these are some of the points that was addressed by Governor Nan Kishore Yadav. Okay. So agriculture sector, more than 70% of Nagaland's population depends on agriculture and allied activities. Focus on strengthening value chain certification and market access for organic products such as pineapple, cucumber, persimmon, Naga king chili, coffee, and agarwood. Emphasis on blending modern technology with traditional farming practices. So, in infrastructure and connectivity, expedite construction of the proposed Chetu Airport, developed additional airstrips at Mukokchung, Twinsang, and Mon, push for foothill road and railway connectivity projects to unlock industrial, mineral, and agricultural potential. In education and youth empowerment, concern over lack of premium educational institutions in the state, demand for establishment of national or regional level institutions in Nagaland, promotion of entrepreneurship, innovation, and skill development, establishment of Nagaland's first drone school and center of excellence under the Nagaland Skill and Entrepreneurship Development Mission. Sustainable development districts of Mokokchung, Kohima, and Dimapur ranked among the top 10 performers in the Northeastern region. Districts SDG Index 2.0 in energy and industrialization, support for scientific mineral exploration and sustainable resource use, Nagaland solar mission to meet 15% of energy needs through rooftop solar system, tourism, culture and sports, promotion of Hornbill Festival and community-based tourism, lead for last mile connectivity, eco-friendly infrastructure, and digital marketing to boost tourism potential. And he also addressed on strengthening the NEC, that is demand for more powers, increased funding, and equitable resource distribution among all 8 northeastern states, guiding principle, peace for development and development for peace. And long-term vision, peaceful, progressive, and self-reliant Nagaland by 2047. So our Chief Minister Dr. Nifuyo also highlighted key projects during the 73rd plenary session of the Northeastern Council. So he addressed on connectivity and infrastructure, Trans-Nagaland Highway. He pushed for the 364-kilometer foothill road to be declared a national highway to boost economic activity across 7 districts, sought union support for land compensation. Air connectivity noted Kohima is the only state capital without an operational airport. Proposed airstrips at Chetu, Mukchong, Mon, Kinsau, plus a full airport at Chetu. Railways. He asked for extension of the Dimapur-Kohima line beyond Zubza into Kohima city, eventually toward Imphal and priority for the Dimapur-Tibet line. In education and healthcare, proposal for an IIT at Nagaki city in Jumlikima district to be submitted soon. Reiterated request for a greenfield aims in Nagaland plus support to upgrade Limsar Kohima. Urban and economic growth. Nagaki city, 39 square kilometer hub in Chate Valley for education, healthcare, innovation and economic growth. He sought for central help for core infrastructure, also proposed flyovers and elevated corridors in Kohima, Dimapur, Jammu to ease traffic. He called for stronger power transmission, hydropower development. So long-term vision, agricultural diversification. Expand coffee from 12,000 hectare to 50,000 hectare by 2047, plus promote agriwood and agri-wood and agri-allied sectors, reaffirmed commitment to Viksit Nagaland at 2047 and Viksit Bharat at 2047 through investments in connectivity, youth education, and sustainable growth. So regarding the Northeastern Council, it was established by the Northeastern Council Act of 1971, okay, and formally constituted in 1972. After amendments in 2002, the Union Home Minister served as the ex-official chairman. So remember this, these are important facts, okay? And the Minister of Development of Northeastern Region as the Vice Chairman. The governors and chief ministers of the 8 member states, that is Arunachal Pradesh, Assam, Manipur, Meghalaya, Mizoram, Nagaland, Sikkim, and Tripura, they sit on the council along with 3 members nominated by the President of India. The council provides a platform for joint planning and funding of regional projects. So 3 members are nominated by the President, Union Home Minister, he served as the ex-official chairman, and then the Minister of Development of Northeastern Region as the vice chairman. The Nagaland Connect 2026 Corporate Social Responsibility Conclave. So this was organized by IDAM, and during the conclave, commitments worth rupees 30,000 crore, okay, has been secured, with Chief Minister Dr. Nifurio urging India's corporate sector to view Nagaland as a destination for opportunity rather than a recipient of aid. According to the state DIPR, a total of 15 letters of interest and CSR commitments worth rupees 30 crore were handed over to IDAM in the presence of Chief Minister, Deputy Chief Minister Thier Ziliang and Y. Patten and other members of the state government during the conclave, which was held at New Delhi. So the conclave theme was 14 partnerships creating impact. So the commitments were secured during a roundtable organized by IDAN and CSR Box that brought together more than 40 companies and culminated in the signing of several memorandum of understanding, letters of intent, and statements of commitment in the presence of Chief Minister and other senior state leaders. Nagaland showcases pioneering disaster risk reduction models at BRICS. The state of Nagaland, through the Nagaland State Disaster Management Authority, Home Department Government of Nagaland presented a series of pioneering disaster risk reduction and resilience building initiatives during the second BRICS technical meeting on disaster risk reduction. So this was held at Puri, Odisha, okay, from June 3rd to 5th, highlighting the state's innovative and technology-driven approach towards disaster management. So the key success stories presented were disaster risk transfer and protection scheme. So Nagaland presented its innovative disaster risk transfer and protection scheme, a pioneering parametric disaster risk financing mechanism designed to provide rapid financial support during extreme rainfall events and climate-induced disasters. So the initiative demonstrates how governments can leverage data-driven insurance and risk transfer instruments to strengthen disaster preparedness, reduce recovery time, and enhance financial resilience against climate shocks. The next is about Ileona supercomputing platform. So the meeting highlighted Ileona, the Advanced Supercomputing and Artificial Intelligence platform, which was developed by NSDMA for high resolution weather forecasting, climate modeling, hazard simulations, risk analytics, and decision support systems. Ileona integrates artificial intelligence, machine learning, geographic information system, and advanced computing capabilities to generate actionable forecasts and risk assessments for data managers or disaster managers, planners, and policymakers. The platform represents Nagaland's vision of utilizing cutting edge technology for climate adaptation and disaster resilience in mountainous and vulnerable regions. The Nagaland State Disaster Management Information System, Nagaland showed the NSDMIS, a comprehensive digital disaster management ecosystem that integrates real-time data collection, incident reporting, resource tracking, damage assessment, relief monitoring, and emergency response coordination. So this system it enables seamless information sharing among state, district, and village level authorities, significantly improving situational awareness and decision making during emergencies. Decentralized relief payment system. So this was presented as a transformative governance, innovative innovation that facilitates transparent, efficient, and timely disbursement of disaster relief assistance directly to affected beneficiaries. By leveraging digital technologies and streamlined administrative processes, the decentralized relief payment system enhances accountability, reduces delays, and ensure that disaster affected communities receive support when they need it most. So we can see here that Nagaland's participation in the BRICS platform highlights India's commitment to the Sendai framework and the value of international cooperation in addressing climate and disaster risk. So through initiatives like Ileona, Nagaland State Disaster Management Information System, Decentralized Relief Payment System, Nagaland is emerging as a hub for disaster risk governance innovation in Northeast India and beyond. So these efforts support the vision of a resilient Nagaland, where technology, science, community participation, and proactive governance protect lives, livelihoods, infrastructure, and sustainable development. So regarding this Sendai framework, it is a 15-year voluntary non-binding UN agreement which was adopted in 2015. So this framework it aims to prevent new disaster risk and substantially reduce existing ones by focusing on four priority areas. That is understanding risk, strengthening the disaster governance, investing in resilience and enhancing preparedness to build back better. Okay. Nagaland Chief Minister Dr. Nefirio attended the 11th Governing Council meeting of Niti Aayog, which was held in New Delhi, where he highlighted the state's progress in governance, infrastructure development, economic growth, human capital development, and digital transformation. He also sought continued support from the center for key projects such as the Foothill Road Greenfield Airport at Chittoor, IIT, AIMS, railway expansion, and Naga Key City. On the economic front, Rio emphasized the need for greater investment in oil and natural exploration, inland waterways, urban flyovers, and agarwood cultivation and power infrastructure. He also cited measures under the Nagaland Strategic Water Resilience Initiative, the expansion of bamboo-based value chains, and programs promoting green economy. In governance, he showcased reforms such as SDG-linked budget architecture, gender budget statement, and outcome budgeting framework, which aims to improve transparency, accountability, and evidence-based policy making. Highlighting women-led development initiatives, he pointed to the Innovation Seed Fund for nano women entrepreneurs and the introduction of pink scooty taxis. On youth development, he highlighted initiatives such as Nagaland Skill and Entrepreneurship Development Mission, Nagaland Apprenticeship and Placement Exchange, Chief Minister's STEM Incentive Program, Academic Excellence Corpus, and Open Learning Support Scheme. In agriculture, he stressed the importance of strengthening food processing and post-harvest infrastructure while promoting coffee and high-value horticultural crops such as kiwi, dragon fruit, avocado, persimmon, and pineapple to improve farmers' incomes and market access. On tourism and culture, he highlighted the Hornbill Festival and mini Hornbill festivals as important platforms for preserving cultural heritage while generating livelihoods and boosting the local economy. Speaking on the theme Human Capital for Viksit Bharat at 2047, Dr. Rio outlined initiatives in education, skilling, sports, and digital governance, including lighthouse school complexes, the Smile app, the moral concept of education, vocational education programs, the Center of Excellence Industry 4.0, and Nagaland Tourism and Training Center Dimapur, and AI skilling initiatives. He also highlighted sport development programs such as Catch Them Young, Teach Them Right tournament, the Nagaland Super League, and the creation of sports infrastructure across districts. On digital governance, CM Dr. Rio cited initiatives including the Personal Information Management System, the Common Scholarship Portal, the Nagaland Spatial Data Infrastructure, and the proposed AI Research Center in Kohima. The International University Nagaland has launched a statewide research initiative titled Ecological Modernization of Traditional June Cultivation. So, June cultivation is also known as slash and burn farming in order to address environmental degradation while preserving Nagaland's traditional shifting cultivation practices. So this project it seeks to balance the state's tribal agricultural heritage with environmental conservation by developing scientific and sustainable alternatives to reduce deforestation, habitat fragmentation, and topsoil erosion associated with shortened June cycle. Nagaland University research scholar Rimpat Kabat of the Department of Sociology presented the university at the United Nations World Indigenous Youth Conference 2026. So remember this conference was held at Kathmandu, Nepal. So this two-day conference was held on June 13 and 14, and it was organized by Youth Federation of Indigenous Nationalities, Nepal, the National Youth Council, Nepal, under the theme Our Roots, Our Rights, Our Leadership, Collective Indigenous Movement for Self-Determination. Participation in the conference was supported by the Indigenous People of Asia Solidarity Fund and the Youth Federation of Indigenous Nationalities, Nepal, which provided travel and hospitality support. So Tetsa College has secured 198 rank in the India Today MDRA survey. So just remember the name of the college and then the rank. MGM College NSS team wins folk dance title at Northeast Festival. So this festival was held at Arunachal Pradesh. Nagaland Industrial Development Corporation Chairperson Kubo Loring. So NIDC. It is the government of Nagaland undertaking and it was established in the year 1970 to promote industrial growth, infrastructure development, and entrepreneurship in the state. So, what does NIDC do? Industrial infrastructure development, skill development and training, digitization. So, NIDC provides term loan at 12% interest rate to support entrepreneurs. Remembering Captain Kengul. So, every year on 28 June, the state of Nagaland pauses to remember a son of the soil whose life became larger than life itself, that is Captain Kengul. He was awarded the Margaret Chakra posthumously. His nicknames are Nimbu Sahib and Nibu. He was born on 15 July 1974 at Kohima district and he died on 28 June 1999. Retired High Court Judge Justice Lanu Sulkum Jamir has been appointed as the chairperson of the Nagaland State Human Rights Commission. So this appointment was made by Governor Nan Kishore Yadav. So Governor Nan Kishore Yadav, he is the 23rd governor. Okay. On the recommendation of the committee constituted under Section 22, Clause 1 of the Protection of Human Rights Act 1993. So Justice Jamir, he has been appointed for a term of 3 years from the date he assumes office or until he attains the age of 70 years, whichever is earlier. So Section 22 of the Protection of Human Rights Act 1993, okay, it talks about the appointment of chairperson and members of state commission. E.R. Cameron Walling takes charge as the new Nagaland Electricity Regulatory Commission chief. H. Hokato Sema from Nagaland was conferred with Ati Vishisht Seva Medal. So Naib Subedar H. Hokato Sema from Nagaland, serving with 9 Assam, who lost a leg in a landmine blast, was conferred with the Ati Vishisht Seva Medal. Okay, so it translates to very distinguished service medal. So it was conferred by President Draupadi Murmu for his distinguished services. So this honor was presented during the Defense Investiture Ceremony 2026, Phase 2 at Rashtrapati Bhavan, where the President conferred 105 distinguished service decorations on the personnel of the Indian Army, Indian Air Force, Indian Navy, and Indian Coast Guard. So Ati Vishisht Seva Medal, it is the second highest peacetime distinguished service award in the Indian Armed Forces. So these are the various Indian Armed Force medals, gallantry medals, distinguished service medals. So under gallantry medals, that is wartime, we have Paramvir, Mahavir, Veer Chakra, and peacetime Ashok, Kirti, Shaurya Chakra. Similarly, under Distinguished Service Medals, we have Wartime Distinguished, Peacetime Branch Distinguished Service Medals. So Kiran Sumi featured in Forbes India Woman Power Edition. So this name feature was titled as the Architecture of Empathy, Kiran Sumi's Blueprint for Public Education. Nagaland student wins Best Responder Award at Youth Parliament. So Kepozo Kapu, a postgraduate student of political science from Nagaland, has been conferred the Best Responder Award at the Viksit Bharat Youth Parliament 2026. The national program was organized by Ministry of Youth Affairs and Sports in collaboration with My Bharat. And this year, the theme was Nari Shakti Vandan, Catalyzing Inclusivity and Viksit Bharat 2047. A grand entry for a grand honor. President Draupadi Murmu conferred the Padma Shri on folk artist Guru Sangyu Sanpongner. Okay, so remember this name during the civil investiture ceremony, Phase 2 at Rashtrapati Bhavan in New Delhi on June 23rd. The arrival of 83-year-old folk artist and cultural guardian from Nagaland, Guru Sangyu Sanpongner, added a dash of vibrant cultural touch to the ceremony. He was dressed in a traditional Naga attire. His spirited entry drew a huge round of applause from the audience, including Prime Minister Narendra Modi, and he received a Padma Shri. So Miss Ovung Beni Ovung has been conferred with the prestigious Sangeet Natak Academy Yuva Puraskar 2024-2025 in the field of folk dance of Nagaland. So Ustad Bismillah Khan Yuva Puraskar was instituted by the Sangeet Natak Academy in the name of Bharat Ratna Ustad Bismillah Khan for young performing art practitioners up to the age of 40 years. So remember this age, okay? So it is given annually to outstanding young artists in the field of music, dance, drama, folk, and tribal arts and puppetry in a special ceremony held in Delhi and also outside Delhi. So the Yuva Puriskar carries a purse of 25,000 rupees, a plate, and an Angavastram. The reason behind instituting the Ustad Bismillah Khan Yuva Puriskar was to encourage and motivate the young artists in the field of music, dance, drama, folk, and tribal art forms and other allied performing arts forms of the country. So who was Ustad Bismillah Khan? So he is associated with Shehnai, okay? And he was the one who played at the first Republic Day celebration in the United Kingdom. And he was also the first Indian to be invited to perform at the prestigious Lincoln Center Hall in the United States of America. Nagaland-based band Pink Eye has been invited to perform at the prestigious Fuse Art Festival in London, United Kingdom. The Nagaland Conservatory of Music, an institution affiliated with Nagaland University, and the reigning champion of the first Nagaland Choir Games 2025, is set to participate in a major cultural exchange program in Thailand. The Indian Studies Center at Chiang Mai University has extended an invitation to the Nagaland Conservatory Music for a collaboration titled Echoes of the Hills, exploring the choral performances of India and Thailand. So this project will be held in Chiang Mai from July 1st to 5th, aiming to strengthen artistic and academic connections between the two nations through music. Four NU researchers participate in World Bank Group Youth Summit. So the 13th World Bank Group Youth Summit 2026, it was held from June 11 to 12 in Washington, D.C., USA. Team Nagaland secured multiple medals at the Fourth National Arm Wrestling Championship 2026, which was held at Rashtriya Raksha University, Gandhinagar, Gujarat. So remember that the Fourth National Arm Wrestling Championship 2026 it was held at Rashtriya Raksha University at Gujarat. India reaffirmed its dominance in South Asian basketball with commanding victories in both the boys and girls categories at the FIBA Under-18 Asia Cup 2026 Sabah qualifiers, which was held at Colombo. So the 2026 FIBA Under-18 Asia Cup, so this is an upcoming international event, okay? So this will be held in India, okay, in Ahmedabad from 3rd to 23rd of August. So this will be the 28th edition of the biennial FIBA Under-18 Asia Cup. So this was previously known as the FIBA Under-18 Asian Championship. The Nagaland government has made online registration and renewal mandatory for all establishments covered under the State's Shops and Establishments Act and the Factories Act with immediate effect. So all the employers, occupiers, managers of factories, shop workers, commercial establishments, entrepreneurs, consultants, and other stakeholders, they must now submit all applications, including those for registration and renewals, amendment, and related services exclusively through the Labor Department digital portal at government.in. Nagaland Police had conducted a Facebook Live awareness program on June 26, coinciding with the International Day Against Drug Abuse and Illicit Trafficking. So fatty liver disease, it is a condition in which fat builds up in the liver. So fatty liver can be of two types. The first is non-alcoholic fatty liver disease, and the second is non-alcoholic fatty liver disease, which is also called as alcoholic steatohepatitis. So you can see here the image. So this is your normal good liver, but if you have fatty liver, then it will become like this. So regarding the non-alcoholic fatty liver disease, metabolic dysfunction associated steatotic liver disease is a type of steatosis that's caused by factors other than excessive alcohol use. So it is a part of the metabolic syndrome characterized by diabetes or pre-diabetes, overweight or obesity. So which means that if you are overweight also you can get fatty liver, okay? An alcoholic fatty liver disease from by the name itself we can get an idea that this is due to heavy alcohol use. So census 2027 Nagaland. So with over 6,100 officials, census 2027 will reach every corner of our state. So it will reach to 1,610 villages, 5 census towns, 39 urban local bodies, and 17 districts and 118 sub-districts. So census, it is kept confidential under Section 15 of the Census Act 1948. Okay. So Section 15 of the Census Act 1948, it records of census not open to inspection nor admissible in evidence. So Nagaland looks to replicate Tripura's renewable energy success. So a 10-member Nagaland government delegation, which was led by advisor for new and renewable energy ER Picto Shohe, visited Tripura from June 23 to 24 to study successful implementation of renewable energy programs, particularly the PM Kusum scheme, and facilitate knowledge and experience sharing. So from here, we have to know about what is PM Kusum scheme. So PM Kusum, it stands for Pradhan Mantri Kisan Urja Suraksha Evam Uttan Maha Abhiyan. So it is the government of India's flagship solar agriculture scheme, okay, that aims to convert the Annadata, that is food provider, into Urja Data, that is energy provider. So this scheme aim is to convert the food provider into an energy provider. So it was launched by the Ministry of New and Renewable Energy in March 2019 and expanded further. The PM Kusum provides farmers with grid connected solar power plants on barren land, solar powered stand-alone irrigation pumps, and solarization of existing grid connected pumps with the dual objective of supplementing farm incomes and decarbonizing the agricultural energy footprint. So the total scheme target is 34,800 megawatt of solar capacity by 2026 with a central financial assistance of rupees 34,422 crore budgeted for the period 2019 to 2026. So PM Kusum has three structured components designed to address different farmers' realities, that is landlocked, off-grid, and grid-connected. So each component opens a distinct income or savings channels for farmers. So there are three components, that is component A, B, and C. So India had committed to reach 500 gigawatt non-fossil capacity by 2030, okay, and COP26 with 300 gigawatt solar. So PM Kusum contributes 34,800 megawatt to this goal with the unique advantage of using land already in agricultural ownership. 12 years of trust development and public welfare under Modi government. So here these are the list of notable achievements of the central welfare schemes in Nagaland. So over 4.13 lakh Jan Dhan accounts, 7.74 lakh Ayushman cards, 1.22 lakh Ujjwala LPG connections, 3.42 lakh rural households with tap water under the Jal Jeevan Mission, more than 14 lakh beneficiaries under PM Garib Kalyan Anna Yojana, 1.88 lakh farmers covered under PM Kisan, rupees 2.75 thousand crore dispersed under Mudra Yojana, and 22 Jan Aushadhi Kendras operationalized in the state. So under the Northeast Special Infrastructure Development Scheme, 17 new projects worth rupees 900 crore and 146 other infrastructure projects worth rupees 1,489 crore have been approved. The Unnati 2024 scheme, with an outlay of rupees 10,037 crore over 10 years, will further drive industrialization and employment generation across the Northeast, including Nagaland. Over 1,670 kilometers of national highways have been constructed in Nagaland as of June 2025, while an additional 208 kilometers of highway corridors worth rupees 2,079 crore had been approved under the Bharatmala Pariyojana. When the fiscal support tax devolution to Nagaland grew by 997.72% between 2004 to 14 and 14 to 26, while grants and aid increased by 154.82% during the same year. Nagaland had received rupees 79,970 crore in grants and aid and rupees 59,327 crore through tax devolution from the government of India since 2014. Beyond finance commission transfers, Nagaland has also received rupees 7,403 crore since 2020 to 21 under the SASKI scheme in the form of 50-year interest-free loans with the interest burden borne entirely by this center. So you can go through these images here. You can go through this. So you can go through this. So from here on, we will be talking about the government schemes that were in the news. Some of the schemes will be repeated because I've already covered them in previous months. But even if it is repetitive, try to recall the facts whenever you see a scheme in the video. And when you see the same scheme coming up again and again in the news almost every month, take it as a sign that it's important. That means we should give extra attention while studying. So let's start with the schemes. Pradhan Mantri Surakshit Matritva Abhiyan. The 10-year anniversary of the Pradhan Mantri Surakshit Matritva Abhiyan was observed across the country on June 9th. So it was launched on June 9, 2016 by the Ministry of Health and Family Welfare. So 10 anniversary, 25 anniversary, 50 anniversary, 75, 100 anniversary, 1000 anniversary. So it becomes important, okay? So the aim of this scheme is to ensure early risk detection, timely medical intervention, and safer pregnancies for every woman in India, regardless of where she lives. So here we have to remember the launch month and year, and then this scheme comes under which ministry and what is the objective of this scheme. So these are the key features of the scheme. So you can go through this. In Nagaland, more than 23,000 pregnant women have received antenatal care under this scheme, okay? While 2,303 high-risk pregnancies were identified and received early treatment. In Nagaland, 60 designated health units comprising of district hospitals, community health centers, primary health centers, and health and wellness centers are currently providing this PMSMA services. So these are the key achievements in the past 10 years of this scheme. So you can watch it. Pradhan Mantri Ujjwala Yojana. So it is a flagship social welfare scheme launched by Ministry of Petroleum and Natural Gas on May 1st, 2016. So this scheme, it aims to replace traditional polluting cooking fuels such as firewood, coal, and cow dung cakes with cleaner LPG gas, that is liquefied petroleum gas. It is instrumental in addressing indoor air pollution, which is a leading cause of respiratory disease and mortality among women and children in rural care. So eligibility criteria is also important. So here we have to know that male members from a household cannot apply for this particular scheme. Okay, so this is one of the key point here. Pradhan Mantri Viksit Bharat Rozgar Yojana. So this scheme, it came into effect from 1st August 2025. So last year, the objective was to promote formal employment, encourage job creation, and expand coverage under the Employees Provident Fund organization. So the target is to create 3.5 crore jobs by 2027 and offering incentives to first-time employees and employers. So this scheme is both for employees as well as for employers. So part A, first-time employees. So this it targets first-time employers registered with Employees Provident Fund Organization and provides an EPF wage support of rupees 15,000 released in two installments. The first installment is paid after completing 6 months of service, second after 12 months with financial literacy program completion. So eligibility is this is for employees earning salaries up to rupees 1 lakh, okay, and saving components to promote the habit of saving. A portion of the incentive will be deposited in a savings instrument or fixed account, which the employee can withdraw after a specified period. And part B, this is for employers. Employers creating new jobs receive rupees 3,000 per month per employee for 2 years. So incentives apply only for new jobs sustained for at least 6 months. In manufacturing, incentives can extend up to third and fourth years, with Part B expected to create around 2.6 crore new jobs. So in PM Kisan, it is a central sector scheme, and this scheme, it transferred rupees 6,000 per year directly into the bank accounts of landholding farmer families, paid in three equal installments of rupees 2,000 every 4 months. So it was launched in the year 2019, okay? So remember this. So eligibility is all landholding farmer families are eligible for it. Earlier, only small and marginal up to 2 hectares were eligible, but later it expanded to all. So PM Swanidhi, this scheme has been in the news for a very long time. So we have to know the launch date, that is 2020. And this scheme, it was formulated to assist the street vendors. Okay, so this scheme is for street vendors. Remember this. So it was launched to help those street vendors to overcome the adverse effects of financial constraints and to restart their lost business during the pandemic. Since the inception of the scheme, it has proved to be more than financial support for street vendors and has given them a sense of identity and formal recognition for their contribution to the economy. So on August 27, 2025, the Union Cabinet, chaired by Prime Minister Shri Narendra Modi, approved the restructuring and extension of the lending period beyond 31/12/2024 of Prime Minister's Street Vendor Atma Nirbhar Nidhi scheme. Now, this scheme has been extended till March 31st, 2030. An outlay of the scheme is 7,332 crore. So the restructured scheme aims to benefit 1.15 crore beneficiaries, including 50 lakh new beneficiaries. So under this scheme, eligible vendors, they can avail collateral-free working capital loans of 10,000, 20,000, and 50,000 in stages. And beneficiaries are also entitled to an interest of 7% subsidy on timely loan repayment and cashback incentives for digital transactions. So these are some important facts. A total of 6,394 loans amounting to rupees 10.52 crore have been dispersed to street vendors in Nagaland under this PM Swanidhi as on June 27, 2026. So Street Vendors Act 2014 and the Nagaland State Rules of May 2019, it legally recognized street vending as a legitimate profession, establishing dedicated zones to manage urban space and shield vendors from unauthorized eviction and harassment. So Dimapur currently has an estimated of around 15,000 plus vendors who have been surviving and working without even knowing their own rights. Mission Amrit Sarovar, so it was launched on April 2022. So this mission was launched with an ambiguous goal of constructing or rejuvenating 75 Amrit Sarovars. Sarovars means pond, okay, in each district, totaling to 50,000 across the country. So each Amrit Sarovar was to have a pondage area of about 1 acre, except in case of states or UTs with hilly terrain, with water holding capacity of about 10,000 cubic meters, except in case of hilly terrain states. So Chief Minister Health Insurance Scheme, so it was launched on 14 October 2022 at Kohima. So this is a flagship public health insurance initiative by Government of Nagaland designed to provide cashless treatment to eligible beneficiaries. So Chief Minister Health Insurance Scheme, it bridges the gap for government employees, pensioners, and indigenous inhabitants or permanent residents of Nagaland not covered under Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. So, Chief Minister Health Insurance Scheme, it benefits across two categories, okay? One is for employee and pensioner, and then the general category. So, for employee and pensioner, okay, coverage is rupees 20 lakh per year per family, for general 5 lakh per year per family. Currently, in Nagaland, CMHIS covers nearly 96% of the household in Nagaland, with the state government bearing a substantial financial burden to sustain the program amid rising insurance premiums. So this was said by an official. The personal information management system has been integrated on 21st April 2016, and it is a comprehensive web-enabled personal management system for the state government to address the administrative requirement for managing its employees right from the date of their joining into service till they retire. So this means it will help in getting access and accurate information about state government employees, including details of transfer and posting details and service history. Availability of timely information is the key to efficient management of service matters of the state government employees. So regarding Nasha Mukh Abhiyan, it was launched on 15 August 2020 by Ministry of Social Justice and Empowerment. So in Nagaland, okay, around a quarter of Nagaland's police force, approximately 5,000 of its over 20,000 personnel are estimated to be struggling with alcohol or drug addiction. So this was said by Senior Superintendent of Police, Mogonchong Vasupara Quezon. So when you see this figure, this is a very serious concern, okay? So Pradhan Mantri Rashtriya Bal Puraskar. So this award is given annually by the Ministry of Women and Child Development. So this award is given for outstanding achievements in bravery, art and culture, environment, science and technology, social service, and sports. So the age group for this award is 5 to 18 years. So remember this age group. So each awardee receives a medal, a certificate, and a citation booklet. So POSH Act, it stands for Prevention of Sexual Harassment Act or Sexual Harassment of Women and Workplace Prevention Prohibition and Redressal Act. It was enacted in 2013 to implement the Vishaka guidelines. So this POSH Act, it covers concepts of quid pro quo, harassment and hostile work environment as sexual harassment. Under the Act, an employee is defined not just in accordance with the company law. All women employees, whether employed regularly, temporarily, contractually, or an ad hoc or daily wage basis, and or daily wage basis as apprentice or interns, or even without the knowledge of the principal employer, can seek redressal for sexual harassment in the workplace. So regarding its applicability, public and private sector, government and non-government sectors, and organized and unorganized sectors, even non-traditional workplaces and places visited by employees for work are covered under this act. So internal complaints committee composition and powers. So this is mandatory requirement. So every employer with 10 or more employees must constitute an internal complaints committee at each office or branch. So this is a hard requirement. Non-constitution is itself an offense under the act. So composition of ICC under section 4. ICC must have a presiding officer, a woman employed at the senior level of the workplace. If no civil woman is available, the presiding officer can be from another workplace or an NGO. So two members from among employees, preferably committed to women's causes and with social work experience or legal knowledge. One external member from an NGO or association committed to women's causes or a person familiar with sexual harassment, and minimum 50% must be women. The presiding officer and members hold office for 3 years from the date of nomination. So local complaints committee. So for workplaces with fewer than 10 employees or for domestic workers, there is no ICC. Instead, the district officer, usually the district collector or additional collector, constitutes a local complaints committee at a district level. So composition of local complaints committee under section 7. Nodal officer at the district level, one woman working in the block, taluk or tehsil, two women from NGOs or women's group, at least one must be a woman from SC or OBC if possible. One officer from SC or SC department. The local complaints committee addresses complaints from the unorganized sector and employees of small employers. So this is where the Act protects the most vulnerable women workers. So this is regarding the Nagaland Women Commission Act 2006, the functions of the commission. So you can go through the functions of the commission. So these are the functions of the commission, and these are the powers of the commission. So you can go through the powers of the commission. So Section 4 of the Prevention of Money Laundering Act 2002. So this section, it talks about punishment for money laundering. So whoever commits the offense of money laundering shall be punishable with rigorous imprisonment for a term which shall not be less than 3 years, but which may extend to 7 years and shall also be liable to a fine. So some articles which were in the news I have covered here, and then some various sections of Foxco Act also been covered here, so you can go through this list. So you can go through section. Section 6 has been in the news. Okay, so study about this section 6 and the subclauses. So all the sections, so all the sections are from the news. Okay, itself. So we can go through this. So you can go through this. So these are some of the various sections of IPC, which was in the news, section 32A, section 354, 506. So you can go through this to have a brief idea of what all this sections talks about. So the Trade Union Act 1926, Section 8 and Section 10 were in the news. So you can go through this. So this concludes the Nagaland session. If there is any information to be extracted from the current affairs, you may do so. And for the complete PDF, please check the link in the bio where all the details have been shared. I hope you have a productive time studying. I'll see you in the next video. Thank you. Bye bye.